Cases of COVID-19 in the U.S. surpassing 425,000 today. And although local cases only make up a fraction of that number, cases in all three Siouxland states continue to rise. That's our top story at 6. Iowa reporting 27 deaths and more than 1,100 cases, including 11 in both Woodbury and Harrison counties and 7 confirmed cases in Sioux. Nebraska reporting 12 deaths as of today, with total positive cases now at 519 statewide, with northeastern counties fortunately not seeing many cases. Madison County has the most positives at 5. Up in South Dakota, the state saw its biggest jump in confirmed cases. The 73 positives reported today brings the state to nearly 400 total cases, including 6 deaths. 2 of the most affected counties are Lincoln with 31 cases and 11 recoveries, and Yankton County with 17 cases and 12 people recovered. You may have noticed we only have COVID-19 recovery numbers in South Dakota, and we've received several questions from viewers about why we don't often report the number of COVID-19 recoveries in the tri-state area. KCAU-9 News reporter Lydia Vasquez breaks down why that question requires a complex answer.
Positive cases of COVID-19 are being reported daily. The number of recoveries is not. That's because that data isn't easily accessible. In fact, some healthcare officials are choosing not to post those numbers. Tyler Brock is the deputy director for Siouxland District Health. He says deciding to post recovery numbers is something the department has struggled with.
It's not a secret. There's nothing that the public can't see about it. We've really tried to figure out how to present it in a way that actually makes sense to the public, that it's actually good information, and that it doesn't honestly create more questions than answers.
Brock says posting recovery numbers may be misleading.
You're going to see the case counts going up a lot faster than the recovery counts, okay? And so what you might end up with is a big gap in the number of total cases and a relatively low number of reported recoveries. And then what's up with the gap? What's up with those people that they're not recovered?
The Nebraska Department of Health and Human Services website tracks positive and negative cases and the number of deaths from COVID-19. The recovery number is nowhere to be found. Melanie Thompson is the Emergency Response Coordinator for Elkhorn-Logan Valley Public Health Department. She says they aren't reporting recovery numbers because they aren't tracking them. Thompson says they don't have the resources to track that data.
For a local health department, right now we are so stretched doing contact tracing of the people who are sick or who have just presented sick and presented with COVID that we are having to, throw all of our resources and everything we have towards putting those fires out. We just don't have the resources to dedicate one more person to following up, and actively calling all these people. We don't have that system in place in the state of Nebraska, at least at this time.
She says there are several factors that come into play to determine whether someone is considered recovered, which makes it difficult to keep accurate data on recoveries. KCAU reached out to South Dakota Department of Health. They said they post recovery numbers on their website because the state is still in the early stages of the pandemic, that if and when they start to see an increase in cases, they may reevaluate. South Dakota Department of Health has a number of recoveries along with the total test numbers of COVID-19 from every county on their website. Lydia Vasquez, KCAU 9 News.